So thank you for all being here today. I do want to take a moment to recognize so many of the folks who are in attendance to help support this effort. First, I want to recognize the advisory board co-chairs, George Sheeran and Tony Cancelleri, as well as other members of the advisory board who are present: Peter Brightstone, Paul DeCosimo, Christine Farazzini, Steve Gold, Jeff Greenfield, Nancy Cooper-Smith, Wendy Ponte, I don't see Butch here, but Butch Yamali and Mike Sapricone. And then we have many elected officials here as well. I do want to thank them for joining us today. State Senator Candace Zenori Fitzpatrick, Nassau County Legislator John Ferretti, Town Councilwoman Laura Ryder, County Legislator Debbie Muley, Mayor Murray, and Long Beach City Manager Dan Crichton, as well as, I don't think we have Senator Bayonne here today, but thank you for coming. Appreciate your joining us for this auspicious occasion. Oh, that's right, and Nick is here from, and we have somebody from the governor's office as well. How are you? What's your name? Thank you. I do also want to recognize former Congressman Anthony D'Esposito, who is a councilman of the town when we started this project, was instrumental in helping us with permitting, and Tom Van Essen, who was the former Region 2 FEMA administrator, who helped us secure the dollars to help build this building. Now, thank you for being here. I also want to recognize our senior leadership from the health system, Dr. Brendan Carr, who is the CEO of Mount Sinai Health System and couldn't be here today, but we are joined by Margaret Pastusco, the president of the Mount Sinai Health System, and I want to thank them both for their support, partnership, and leadership. We also have our ED leadership here, Dr. Jay Itzkowitz, chair of emergency medicine, and the entire, well, not the entire, but many members of the ED staff who provide great attention and care to our patients and have been doing so for the last 5 years under constant construction. So I do want to thank you for the great care that you've done. Andy Triolo is our Vice President for Facilities, and his entire team for overseeing this project and getting it done. And again, all of our advisory board members, specifically our co-chairs, Tony Cancelleri and George Sheeran. So with that out of the way, we are here today for actually a very great thing to do, which is dedicate this new department, the Fennessy Family Emergency Department, in honor of Joe Fennessy, the former chair of the Mount Sinai South Nassau Board of Directors, and who had served in that role at the time that this building and this ED were conceived and authorized by the board. This project is a $50 million commitment that was made by the board at that time, and he and my predecessor, Rich Murphy, saw the need to expand the emergency department and how it would help the hospital on its path for many decades to come. Tony's going to do a more formal introduction of Joe Fennessy in just a bit, but I just wanted to pause to recognize Joe's dedication to Mount Sinai South Nassau. Not only, well, not that's Tony, the other Tony. Not only his significant financial contributions, but really more importantly, his service as a volunteer board member over many, many years. He didn't allow us to tell you how many years, during which he lent us his considerable expertise and insight into finance and management. His vision for what Mount Sinai South Nassau could be has helped propel the hospital forward, and I'm deeply grateful for all his continued efforts to bring advanced healthcare services to the South Shore. For those of you who don't know me, I'm Rob Sharma. I'm the hospital president, but I'm also an emergency medicine physician and a toxicologist. And so it's very rare in a career in emergency medicine to get to design a brand new ED. And with this opportunity approached in 2015, I jumped on it. And working with the then chairman, Dr. Josh Kugler, we put together what we felt would be the most forward-facing emergency department in Nassau County. We had this little problem called COVID that happened during the middle of the construction, and we had to stop what we were doing because we learned so much during COVID that we said we cannot build a new ED and not incorporate all of the lessons learned. So many of the things we learned during COVID are part of this ED, including significant air handling, which keeps patients safe by keeping infectious air, pumping it to the outside and keeping clean air on the inside. The way we've designed triage, so that if we have another pandemic in the future, the triage rooms can actually work as isolation rooms, and a host of other changes that were made, all designed to keep patients, visitors, and staff safe. It also gives us tremendous flexibility to increase throughput and to be able to see patients more quickly, so patients get the care they need in a more timely fashion. When this ED is finally finished, it will be the size of a football field. So 300 feet, actually 340 feet from end to end, with 50 hard-wall private exam rooms and 4 trauma resuscitation bay areas. As you know, we are a level 2 trauma center. And now we can convert all of the ED exam rooms to outside air, as I mentioned. The new design also will result in significant sound reduction, distraction reduction, and improved privacy for all of our patients. It also has a separate and private area for behavioral health patients, and Mount Sinai has remained committed to the care and services of this vulnerable group of patients, and the area is staffed by psychiatrists 7 days a week. We also have multiple neighborhoods in this new ED. There will be a pediatric neighborhood where pediatric patients will be treated in a special area designed for the needs of children. And thanks to the help of Tony Cancelleri and Mary Lou Cancelleri, we also have tools available for children who are on the spectrum, for whom an ED visit is a very traumatic experience. And so we have special rooms outfitted for those patients with those specific needs to help reduce the anxiety and stress associated with an ED visit. But none of this could have been done without the support of the local community. Of the $50 million cost of the renovation, more than $10 million was raised from donations by the community. So appreciate everything that the community has done to support this effort. And of course, this ED is here to serve the community. I'm very excited what's happening here at South Nassau. We're bringing next generation healthcare to the community, and the ED renovation, honestly, is just the beginning. You see this beautiful new building. It's 4 floors tall. The ED is on the first floor, but we have 40 new critical care beds opening in just a few months, and then later in the year, we'll be opening up 9 brand new operating room suites, which will bring us the ability to do the most complex care right here in Oceanside. Joe Fennessy and Tony and our leadership team at Mount Sinai don't believe our patients and their families should have to travel for advanced care, and today shows that we're making good on that promise and bringing those services locally. So thank you all for now. I'd like to introduce the president of the Mount Sinai Health System, Margaret Pastusco.
Thank you, everybody. Thank you, Rob, so much. And needless to say, it takes a village to make something like this happen. And Rob, you've done an amazing job in leading the team and also with everybody's help here. It's truly inspirational what a community can do. On behalf of everyone at Sinai, I'd like to thank and recognize Joe and his family for their amazing, generous support of Mount Sinai South Nassau. Joe has been instrumental in bringing South Nassau as part of the Mount Sinai family, and we are forever grateful, and we're counting on Joe to continue in his leadership as part of the Board of Trustees of Mount Sinai so that he can inspire the entire health system towards the next advancement and generation. We are incredibly proud of our South Nassau flagship for Mount Sinai on Long Island. We are very competitive, and we plan to show the entire Long Island how amazing South Nassau is in its constellation in healthcare across the island. The emergency department will provide a wonderful benefit to our community here, and we are beyond proud to be able to give this amazing facility to match the quality of the care that's being delivered and improve the patient experience for many, many decades to come. We are also happy for the providers who get to come to work in a new environment. It cannot be understated how much that matters, as well as for our patients. I do want to say this is just the beginning. There's going to be many expansions of services, and I hope that I can be a part of opening those up and win the bet with Brendan Carr, because I got to win to come here today and represent Mount Sinai while he gets to do some other boring meetings. So I want to congratulate Dr. Sharma along with his team. Andy, you're tremendously remarkable in bringing this construction together. I just have to say that. Dr. Abella Kugler-Itzkowitz for your amazing efforts and nonstop efforts in providing first-class emergency care in this truly spectacular space. So thank you. I hope everybody gets to enjoy it. And this is a huge win for the community and our patients. So we're all grateful. Thank you.
Thank you, Margaret. And now it's my pleasure to introduce Tony Cancelleri. He's currently the co-chair of the advisory board, and with Joe, he sits on the Mount Sinai Health System board as well. Tony?
First time I had more people standing behind me than in front of me. Please sit down. A standing ovation is not necessary. Good morning, and thank you all for being here. Rob, thank you for your leadership and dedication. Margaret, your support, encouragement goes a long way. We made the right choice going with Mount Sinai. Thank you. Dr. J and your team, incredible. To run an emergency department while construction is going on for 5 years and have our performance metrics increase is just beyond belief. You guys did a great job. Thank you. Andy and your team, we recently went into a step down home, which was being renovated. We thought we could stay, my wife and I, while the construction was going on. The first day we had to move out for 5 months. Andy, how you planned this, coordinated it, overseeing the operation was just unbelievable. Great, great job, you and your team. Well, it's my privilege and honor to introduce Joe Fennessy this morning. I've introduced him many times over the years. There's a lot to say about Joe. Joe was the leader of our board when we first started talking about doing something like this. He has a keen knowledge of hospital finance. He understands the healthcare needs of the community, and he was the leader that held us together with our leadership team in formulating an unbelievable capital plan, $500 million, including this wonderful emergency department, the largest capital plan in the history of Mount Sinai, South Nassau. Joe, thank you so much for your leadership. Incredible. You know, Joe has also been a very major contributor financially to our hospital. Joe has a favorite saying, which is, it's not how much money you have, but what you do with your money. And he lives by that. He's the first one to step up and put his money where his mouth is. He also always has his opinion, but he puts his money up there. You know, this morning, I came a little bit early to ride around the hospital, and I got goosebumps seeing all of the improvements to this 1927 built community hospital. It's amazing. There's a buzz going on in Long Island about this hospital. And in large measure, it has to do with having people on the board working with our leadership team and having Joe at the helm for 7 or 8 years as our chairman. Unbelievable, unbelievable work. But I think also the Fennessy family, you're gonna have goosebumps also. Where are you? You behind me, in front of me? Generations to come of the Fennessy family will ride by this hospital and look up and see Fennessy Family Pavilion, Fennessy Family Emergency Department. How wonderful is it to think of, hey, that's my grandfather did that. That's my great-grandfather. That's my father. So proud, and they should be proud. He's a wonderful man, a wonderful leader, a good friend. Ladies and gentlemen, Joe Fennessy.
Thank you, Tony. Thank you. From your mouth to God's ears about great-grandfather. Although all 5 of my grandchildren were born here at South Nassau, so that's accomplishment. If we stand here much longer, I'll be a patient in the emergency room because my arthritic knees are just about to give out. So, Tony did a great job, and Rob did a great job in acknowledging all of the people who have been involved in giving care. And Tony, thank you for those kind remarks, and good afternoon to all of you, and thank you for joining us on this very special occasion. I recognize my family over here. I have my 3 daughters, Carol, Donna, and Joanne, my son-in-law, Anthony. So I want to thank them for being here. They, along with my mother and brother, have been big supporters of the emergency room by being in there often and having wonderful care taken of them. I am humbled and honored that the Fennessy name is associated with this state-of-the-art ED. I've always said that the ED is the main entrance that we keep in the back of the hospital. You know, we have the entrance on Healthy Way, but this is really the main entrance. So many of our patients, their first experience with South Nassau is through the emergency department. This new facility now will allow our entire award-winning, our nurses did a good job in winning an award for emergency medicine, and all of our ER professionals to provide an ever-increasing level of care in our ER. Whether a patient is treated and released or needs additional care, that patient can rest assured that our team will provide them with the highest level of compassionate, professional care in probably the most leading facility now on Long Island. And if they need even more care, access to the renowned Mount Sinai health system. So it's the complete package, and I'm so glad that it has come together the way it has. The Fennessy Family Emergency Department and the entirety of the file pavilion, which Rob and Tony mentioned what's going to be going on here, demonstrates the commitment of the Mount Sinai health system to providing the most advanced medical services to the people of Long Island. We're in it full time. And to kind of say what Margaret said differently, I'll quote Frank Sinatra, the best is yet to come. So I and my family are delighted to be with you here today and appreciate your attendance at this dedication. And hopefully we see you in other causes, but that's always ready in case we need it. Thank you very much.